and all of the tape edges underneath.
Yeah, I'm just pulling it up
fingers
together, all right, because I don't want to touch the skin. And I'm going to observe. And that looks like, what size if I'm using coins? Probably a nickel size.
Nickel.
Okay, and so I'm going to say that there's some sanguineous discharge because it's the bright red in there. And then that dark brown tends to be old blood. So that would be, so I'd say about a nickel size sanguineous discharge. Exactly. That's how I would drop it. Now I'm done with this. This is going to go into my wax paper bag, which eventually will all get wrapped up and be thrown into biohazard. Okay. A lot of times you don't see these out there. They don't have them out there. You might just have the biohazard. Okay, to do. Now I have to clean the dressing. Now in your checkoff sheet, I know we have you remove your gloves, and they don't, because I'm going to take to cleanse it sterilely, but my tools are sterile. The tips of my tools are sterile, so I can keep this. Your book has you keep the same pair of gloves on. I always say you never get marked off for changing your gloves and washing your hands, as long as you remember to wash your hands. Okay, you know, it can always err on the conservative side. I have to go ahead and cleanse this wound. One of our other principles of sterile asepsis, and even medical asepsis, is the head is always cleaner than the feet, right? We always consider the head of the body cleaner than the lower we go, the dirtier we get, right? So we always consider the head to the feet. So that's going to guide your direction of how you clean your wound. You're always going to start at the top of the wound and move closer to the feet, all right? You see I have three, actually they're like big Q-tips, you'll see in a minute, and they're loaded with povidone iodine in there. And I'm just going to go ahead and cleanse them from the top to the bottom. Now they look like this, and they've been sterilized, and as long as I don't touch the tip, it's sterilized, right? And once I touch the patient's skin, it becomes unsterilized, but it's unsterilized to his microorganisms and pathogens. So I actually start in the middle, and you can like roll down, okay? And I will throw this away. Then I get number 2. You see what I'm doing with my hand here? I'm so used to, if I'm gloved, I always keep it in my eyesight. That's because even though this isn't sterile, I'm still watching my hands. Then I'm going to actually go and further away, down, and then last one closest to me, so I don't have to reach over it again. I can reach over that wound with all of this stick, right? Because why? The stick is sterile, right? Only where my fingers have touched is non-sterile. Okay, so I've cleansed his wound. Now that I've gotten rid of the dirty part, I've touched the dirty dressing, I've cleansed the wound, excuse me, postnasal drip, and I can get rid of my gloves. So I'm going to take my hands down as dirty, pull them off, put them in my little baggie, wash my hands, because every time I remove my gloves, I always wash my hands, right? Then I'm going to go ahead and I'm going to remove the sutures. Now, there's a couple things you need to remember about removing the sutures. It is a sterile procedure, so you don't want to be reaching over. But your instruments are sterile. Your book tells you to put on sterile gloves. You can do that too if you want to. Or you can put on regular gloves and just do it with the instruments. Because again, the tips, as long as the tip of the sterile instrument touches that, sterile to sterile is sterile, right? So I'm okay that way. But you're going to want to prep everything again. Now I'm in round 2 here. You saw I set everything up. I don't like to set things up earlier than I need them, just because I don't like to have to reach over them. I worry about reaching over. If I open up a sterile gauze, I want to make sure I'm not going to reach over it. So I do it step 2.